And some people who have frequent nasal congestion have nasal polyps to blame. They can interfere with breathing, your sense of smell, and even your sleep.
That's right. Dr. Madan Kandula is a board-certified ear, nose, and throat surgeon from Advent, and he's here with a new treatment that's a real game changer. Good to see you again.
Good to be here. Thank
Sounds
you.
probably real good to people,
Yeah.
especially those with nasal polyps,
Sure.
which is what you want to address today,
Absolutely.
right?
And it's kind of, polyp folks are sort of this kind of tucked to the side group of people. They get forgotten about. A lot of folks don't know they have this issue until we go and look at it.
So you can't feel them.
You can't necessarily feel them unless sometimes they get really, really big and they're almost hanging out of the nose. Then you know, okay, you got a problem. Short of that, you can kind of think that, well, something's not right. So folks who have polyps, you know, they can affect their breathing, sinus areas, lack of sense of smell, those sorts of things. So all that polyps are organized areas of swelling that happen in the body. So not everybody's body can form polyps, but some folks can, about 10% of the population. And so for those folks who can, it's basically like shoving a bushel of grapes up your nose and walking around with that and not knowing.
Not going to smell a lot.
No, exactly.
Yeah.
So it's annoying, it's frustrating. The other deal with polyps is if somebody has that tendency and they form polyps, they're there. Medications can't get them to go away. Medications can kind of shrink them down, sort of, kind of, but not really. What we need to do is get rid of them to help, and then sometimes they can come back. Where meds can help is they can help to prevent them from coming back, but it's always a matter of, you know, how can we remove them to get somebody feeling better.
Well, you said it was interesting because you said people may not even know that they're there. How do you know that they're there? So what type of diet, what's involved in figuring out that someone has them?
Looking. I mean, it's as simple as that, but I mean, a lot of folks who have nose issues, and I kind of harp on this all the time, a lot of folks who have nose issues, simple issues or complicated issues, never have had their issues fully addressed, vetted. You know, looking simply, we can do some simple things, just looking with a headlight or a camera in the office or CT imaging or whatever we need to do. It's really kind of an odd thing, but at this point, I've been doing this long enough where I can kind of hear it. When even if somebody's not a patient of mine and I'm just talking to them, you can hear that something's not right. It's just a change in the tone of the voice. And then, you know, for folks who don't know, it's finding out. For folks that do have it, you know, it's a matter of, well, what can we do about it?
So what's this game changer? Because there's a new procedure that you're doing that really does change the game when it comes to polyps, especially.
So removing polyps, you know, traditionally over time has been going to surgery and removing them that way. We certainly still have that option, and for many folks who have polyps, that's the best option. But there's something called PolypVac, which is an in-office way to remove polyps. So again, we got if somebody has them, we need to get rid of them.
PolypVac, you suck them out?
We get them out, exactly. Basically,
Really?
it's a device that's hooked up to a suction, and it literally just sort of gently teases them out of there. So it works great. We do it under local anesthesia in the office. A lot of things are moving to the office for what we do, which is kind of a big game changer. So we can do this in combination with some other things, but it really is removing them, which is, like I said, that's the key, getting them out of there. And then for some folks, there are other things, like I said, we can use in conjunction and doing things medication-wise on the back end. And so if this is a good fit, it's nice to know, okay, well, yeah, we have this option that's a little less intense than surgery is.
And let's talk about the combinations in just one sec, but is the recovery fairly quickly?
Yeah,
because, you know, you do it in office. I'm guessing that people, you know, can get back to regular routine.
Yeah, I mean, our typical in-office procedures, you know, typically back to work the next day, school, whatever you're normally doing, exercise. There's nothing, you know, there's not a big restriction there. With surgery, there's certainly some downtime and some off time, and so yeah, it's been a really big game changer. We started this about a year ago. We introduced this to Wisconsin, and it's been, you know, taken off like gangbusters.
And that's something that you do oftentimes is teach other doctors in town. Is that the same thing with this PolypVac?
Yeah, I mean, it's a neat thing at this point. Again, we've been doing this long enough, and we've been really focusing on sort of cutting edge treatments and in-office treatments. And so industry, so the folks who invented this device reached out to us and said, hey, you know, would you be interested in looking at this? And again, it's nice if something looks nice, but it's better if it works. And this works great for a lot of folks.
And what's the combination treatment? So if you use the PolypVac, then Propel is something that you...
Yeah, so steroid medications help to shrink polyps down. The problem is if somebody's got a nose full of polyps, steroid medications can't get where they need to get to. So if we can open things up with the PolypVac, we can also use balloon sinuplasty up in the sinus areas, get things open, step one. Propel is a steroid implant that gets embedded up in the sinus areas, and it just dissolves away. So we can get that steroid medication on the surfaces where it needs to get to, it can help. And so that's where it's been really a neat thing for me, just trying to figure out how can we use the tools that we have nowadays to help. And those tools are always changing, which is great. And so this is something that's great. it's great. PolypVac specifically great for folks who've had, who have polyps and been sort of reticent towards doing something about them. For folks who have polyps, they can come back. So if you've had surgeries and you say, okay, I had surgery and they came back, and that's a bummer. It is a bummer. But a lot of times we can, for especially, or even for those folks, we can address that in the office. And it's a lot easier just process and recovery. And it still works. I mean, so again, getting rid of them is the key. And so however you can get rid of them is great. It's just a matter of what the right fit is for each individual.
Yeah, get that relief. I love that you guys always seek out new and innovative ways to treat patients so the quality of their life is truly improved. If you think you have polyps or you've got trouble breathing, snoring, any of those problems, contact Advent Sinus and Allergy Center. This time of year especially, you're going to feel those changes in your sinuses. 414-771-6780, advent.md. You're right in Tosa off Mayfair Road, and then there's one in Mequon on Port Washington Road. Thanks so much for being here, Doctor.
Thanks for having me. Thank you.
Great to see you.